Hi dost, how are you? Welcome to Nidhya Medical Academy. Today's 10 challenge questions. These are questions very important for the competitive exams. Those daily we are explaining the 10 MCQs which are frequently asking in the competitive exams. So in today paramedical exams special daily 10 MCQs challenge. The first question. Let me go with the first question of today. Right. Before going to start these questions, please share, subscribe, like. Right. And today first question is, which one of the following is not a neurotransmitter? Those, the question is specifically asking about neurotransmitters. What is this neurotransmitter? Those, let me give the comment. Right, let me give the comment. What exactly this neurotransmitter? Right, post your comment about the neurotransmitter. What do you know about the neurotransmitter? Sir, we know WhatsApp Messenger, we know Instagram Messenger, we know Facebook Messenger, right? But we don't know neurotransmitter is a messenger. That's what you are, right, giving the reply, right? So here you just remember neurotransmitter, it's a chemical messenger. Dost, neurotransmitter is a chemical messenger, dost. So it transmitted the information, it challenging the information to transmit from one area to another area. It's a rapid transporter, like a rapid Ola, like that. It's a rapid transporter. Speedily pass the message, speedily pass the information from one area to another area. These neurotransmitters are special chemical messengers in nervous system. These are different type of neurotransmitters in the body, and these different type of neurotransmitters are act differently according to the situations. Here in this neurotransmitters, which is not a neurotransmitter, we need to identify, right? Not a neurotransmitter. The question is in negative format. So not a neurotransmitter. That means we have to eliminate first neurotransmitters from the options, then identify the answer. So I am eliminating the neurotransmitters and identifying the answer. Let me go with this. Cortisol is not a neurotransmitter. It's a glucocorticoid. Cortisol is a glucocorticoid. It's not comes under the neurotransmitter. It's not secreted in the nervous system. That is very important. Glucocorticoid secreted in blood, not in nervous system. That is very important. This glucocorticoid from the adrenal gland secreted into the blood, and it's not considered as a, right, a neurotransmitter. Acetylcholine, exactly, first identified neurotransmitter called as a acetylcholine. This acetylcholine are helping for a learning purpose. Dost, ACH is a wonderful neurotransmitter in our body. It helping for the learning process. And you know this, right, this epinephrine, and we called as a adrenaline. Epinephrine and adrenaline, both are same names, right? Epinephrine also called as a adrenaline. This adrenaline is a fight or flight neurotransmitter, right? Fight or flight neurotransmitter. You know, those. This adrenaline especially activated, this epinephrine especially activated during the stress. So when we are facing the stress at that time, one chemical messenger which is activated in our body, that is called as a epinephrine. We also called as a adrenaline. This neurotransmitter we also called as a fight or flight. Means if you are facing any stress, this neurotransmitter messaging your body, messenger in your body act like a fight or flight. There is only two options to escape from that, right, stress. One, fight against the stress. Another one is flight from the stress. These two mechanisms are, right, sent by a neurotransmitter called as a epinephrine. So this is a neurotransmitter. This one also neurotransmitter. Norepinephrine also neurotransmitter. Dopamine also neurotransmitter, right? So these all are GABA also one of the neurotransmitters. So these all neurotransmitters are act in the body for a chemical messenger purpose. So here these three options where I am eliminated, and the right answer is cortisol. The right answer is cortisol dose. So let me go with the next question. Hope, right, you understood this question. Which one of the following is not a chemical transmitter? In given options, we have to eliminate, first identify the neurotransmitters. So acetylcholine is one of the neurotransmitter, epinephrine is one of the neurotransmitter, non-epinephrine is one of the neurotransmitter. In these four options, cortisol, that means glucocorticoid, this is not a neurotransmitter, right? Especially this is like one type of right, hormone. It acts like a anti-inflammatory, and it released during the stress also, right? It released during the stress also, right? So to provide the energy, to provide the glucose, to release the glucose during the stress, helping by the cortisol. This is one of the wonderful mechanism by the glucocorticoid in the body. It's one of the life-saving chemical. This is one of the life-saving chemical. That is very important. You need to understand this hormone, right? Then next question. The middle layer of meninges is, in the middle layer of the meninges, what is this meninges? Meninges, it's a protecting layer of CNS, central nervous system, right? Central nervous system having two major organs, those you know well. CNS having two major organs. One is called as a brain, another one is called as a spinal cord. These two are the main organs of CNS, central nervous system. These two organs are protected by a layer called as a meninges layer. Meninges is only the protect layer of two important organ of CNS. One is called as a brain, another one is called as a meninges. The question is the middle layer of meninges. That means meninges is having three different type of layers. From outside to inside we check, right? Then go to the inside to outside. From outside to inside, if we have to check, pia matter, arachnoid matter, dura matter. Right? From outside to inside, if you have to check, right? So there is a pia matter, right, and arachnoid matter and dura matter. So this is what exactly the three layers: pia matter, arachnoid matter, dura matter. In this, the question is middle layer. Middle layer is always called as a arachnoid matter. So here, if you have to see this, arachnoid is a middle layer. That is very important. Very important of this is arachnoid is a middle layer, right? Below arachnoid we call as a subarachnoid. Below arachnoid we call as a subarachnoid. So this subarachnoid space filled with you know that CSF, right? Cerebrospinal fluid. Subarachnoid space filled with cerebrospinal fluid. So here, those, remember in this question, the middle layer of meninges called as a arachnoid matter. What is this choroid flexus? What is this choroid flexus? This choroid flexus is a area which has to secrete the CSF. Choroid flexus is a area which has to secrete the CSF, cerebrospinal fluid secreting area. Cerebrospinal fluid mother town is choroid flexus. Choroid flexus is a mother town of cerebrospinal fluid, and it can be travel into, right, space called as a subarachnoid space. Cerebrospinal fluid mother town is choroid flexus, right? That is especially if you have to see in the, right, ventricles of brain, the zone, lateral ventricles of the brain. That is very important, you just to remember. Lateral ventricle of the brain is a mother town. In that mother town, specific home of mother town, choroid flexus for the CSF. The CSF travel into the spinal cord at the space of subarachnoid. At the space of subarachnoid, and it can be absorbed in a choroid villi. Absorbed in, right, arachnoid villi, especially if you have to see this absorbed in arachnoid villi. That is very important to remember this. So ultimate here the middle layer of meninges is called as a arachnoid matter. That is very important to remember. Then go to the next question. The next question is very specifically they are asking the question, the injury which nerve leads to wrist drop. Oh, very simple question. Those at what condition? What condition this wrist is dropped? At what condition this wrist is dropping? Here the question is which nerve injury leads to wrist drop? Right? In the given question, which nerve injury leads to wrist drop? There is your options. Axillary nerve, right? Median nerve, radial nerve, and ulnar nerve. Which is the right answer? Right answer. Type in comment box fast. Which is the right answer? Guess the right answer here. Those. Which nerve leads to wrist drop? Simple question. If you have to check these 4 type of nerves, this axillary nerve mainly damaging the deltoid muscle area. If it is the axillary nerve damage, we commonly see this deltoid muscular area damage. And if it is the medial nerve, those two, you know that this medial nerve, which is called as a software employee nerve, right? Software employee, you know this, right? This medial nerve, especially if you have to see carpus tunnel syndrome, we can see this carpus tunnel, right? So that we can see, right? And here wrist drop specifically we can see this, that is called as a, right? Wrist drop we can see a damage of a radial nerve. Damage of this radial nerve damage, which lead to wrist drop, right? Wrist drop especially seen radial nerve damage. And one more, there is a ulnar nerve. We see that claw hand injury most commonly we see in ulnar nerve damage. Those, the question is very specifically they are asking wrist drop nerve injury, specifically we can see due to the damage of radial nerve. That is very important to remember, right? Let me go with this, right? This is what exactly those. Then check with the next question. Cushing trade, not Cushing syndrome. Those, don't confuse with the Cushing syndrome. This is not a Cushing syndrome. The question is Cushing trade. Trade means particularly there is a 3 classical sign joined together called as a trade. Right? In a medical terminology, trade means any 3 similar features joined together. Ultimately, 3 similar features joined together. In medical terminology, we call as a trade. So here, Cushing's trade, which we call as a Cushing trade. Dost, when we call as a Cushing trade, especially we can see in the, right? So when this intracerebral pressure, right? So intracerebral pressure, when the intracerebral pressure, especially, right? So intracerebral means intracranial, this intracerebral or intracranial pressure, when the intracranial pressure increased in the body, right? This intracranial pressure when increased in the body, there is a sign we can see that's vasoconstriction. So this vasoconstriction again leads to, due to this vasoconstriction sign, there is a irregular respiration. Most commonly seen this feature, irregular respiration. Due to this irregular respiration, there is a decreasing of blood flow to the brain. There is a decreasing the oxygen levels, consumptional rate to the brain. There is a increasing of carbon dioxide pressure in the brain. Due to this, we can see one more classical sign that is called as a hypertension. That means BP. Hypertension means BP. BP is increased. There is a irregular respiration, one classical sign we can see. One more, there is a increasing of the blood pressure, that is called as a hypertension. And one more classical sign we can see this, that is called as a bradycardia. That is called as a bradycardia. That means heart rate is decreased, blood pressure is increased, heart rate is decreased, irregular respiration. These three joint classical sign we called as a triad. This joint three classical sign we called as a triad. So this three combination which we called as a Cushing triad, which we call as a Cushing triad. So here in the right, so Cushing triad is seen especially in which type of condition they are asking, right? So you write, don't confuse with the similar term. Here Cushing means you directly answer this question, but this is not a Cushing right, a syndrome question related. This question is Cushing triad, which is right, which is related to the increased ICP. The question is which is related to the increased ICP. Like this, right, in competitive exams, they should give the questions which right, very similar confusion with the option, right? So that is very careful, right, to attempt the answer. So here the Cushing triad is seen especially increased intracranial, due to the increased intracranial pressure. We can see this Cushing triad. We can see this Cushing triad. Those. Let me go with the next. Right. So here we can see that one more question. The paralysis of the both upper and lower extremities is known as, that is very important. Those paralysis of upper and lower extremities is known as. If you have to see this paralysis, you know that, right? So this due to the nerve damage, most commonly we can see this sign called as a paralysis. So there is a paralysis in medical term, simply we called as a plagia. So this paralysis simply we called as a plagia. So there is a different type of the plagias we can classify according to the right. So extremities damage. Let me check. If there is any one extremities, those we have two upper extremities, two lower extremities. So here we can classify according to damage of extremities. First, right, monoplegia. Monoplegia means any one extremity of four limbs. Means we have two upper limbs, we have two lower limbs. Right. Apart from this, any one limb damage, which called as a monoplegia. Monoplegia, only one limb damage. If you have to see this hemiplegia, any one side, right, two limbs we can see. That means right, either the left side, either the right side. So left side, one upper limb, lower limb. Otherwise, right side, one upper limb, lower limb. This which we call as, right, hemiplegia. Hemiplegia means half, right? So this hemiplegia we can see, right, one side of limbs. That means one hand, one leg, one side. There is a right, diplegia. Diplegia is nothing but here, right, either the both limbs of upper, especially, right, either the both limbs of upper, which called as a diplegia. If it is reverse, like both lower limbs or paralysis, that is called as a paraplegia. Those both lower limbs or paralysis, that is called as a para. Right? This para, this dipla. Right? Any one mono, one side hemi, But those here both extremities combination means both extremities means four limbs. Here four limbs or paralysis. Four limbs means all limbs or paralysis. All limbs are paralyzing. This condition we called as a quadriplegia. So this is what exactly the strategy those, right? So mono, single, one side hemi, right? Only upper dipla, only lower para, or four quadra. Quadra means 4 limbs paralysis, that is called as a quadriplegia. Hope you understood this 5 different type of the plegias. Right? The question is which is related. Right? Question is paralysis of both upper and lower extremities. So both upper extremities and lower extremities are a paralysis. That condition we call as a quadriplegia. That condition which we call as a quadriplegia. So in this fifth question, the right answer is quadriplegia. Those. Let me go with the next. Right. The question is abnormal communication. That may be between urinary and genital, or right, and genital tract. This term which we call as a genitourinary dash. So there is a specifically asking this. There is a abnormal communication between two organs specified. Abnormal communication between two organs. One which they given the urinary, right? So that means urinary means either the bladder or uterus, either the bladder or urethra, either the bladder or urethra, right? Otherwise there is a genital means especially we can see this genital means vaginal area. So there is a abnormal communication between the right urinary bladder, right, and vagina, right? Urinary bladder and vagina, genital area specified with the vagina, right? So if there is a abnormal communication between the urinary bladder and vagina, what it termed as specifically genitourinary. What the question is? Genitourinary abnormality we call as a genitourinary fistula. This abnormal communication which called as a genitourinary fistula. In this genitourinary fistula, very simple those. What is this genitourinary fistula? What exactly this genitourinary fistula? If you have to see this genitourinary fistula, here there is a right, so miscommunication means there is a abnormal joint can seen in between two different organs. One is called as a urinary bladder, another one is called as a vaginal zone. So this vaginal area which connected with urinary bladder. So in that case, what will happen? What will happen here? We can see this, right? If there is a if there is a vaginal area, this vaginal area, right, this vaginal area either connected with this bladder, this vaginal area either connected with this bladder here, right here the urine from the bladder directly come into the vaginal area. That means so that is continuous urine pass seen in the vaginal area. So this condition we call as a genitourinary fistula. Right. So go with the next question. Let me go with the next question. The question is right, ejaculatory duct open into the you know this ejaculatory duct. This ejaculatory duct which travel from the testicular area, means you know that, right? From scrotal zone to right testicular zone to right, it travel into the neck of the bladder area. This neck of the bladder which we call as a prosthetic, neck of the bladder area which called as a prosthetic urethra. So this ejaculatory duct which connected with prostate, remember those this ejaculatory duct which has to connected with prostate, this prostate area. So here this ejaculatory duct carries the sperm, right? This sperm come into the urethral zone. This urethral zone which connected the specific area called as a prosthetic urethra. The specific area called as a prosthetic urethra. So you know those, right? In the male, right? Sperm and urine travel with a similar track. Right? In same track there is a passing of the urine, passing of the semen. Both are travel in one track. So that connection zone which called as a prosthetic urethra. In this prosthetic urethra, we can see connecting of this ejaculatory duct, right? That's what in male there is a similar passage, only one passage that is called as a urethral passage. In this urethral passage, urine will be passed. At the same time, semen also pass in the same track only. This is what exactly we need to remember. Let me go with the next question, those. Let me go with the next question. So today the next question is sixth cranial nerve, abducens, right? That is a sixth cranial nerve which is called as a abducens. Controlled what type of mechanism? There is a different type of 12 cranial nerves, right? We specifically act in the body. 12 cranial nerves which specifically act in the body. So in that sixth cranial nerve, that is called as the abducens. This sixth cranial nerve, right? What type of mechanism, right? In given options, what type of mechanism? See, this sixth cranial nerve specifically, if you have to see, the sixth cranial nerve act for eye movement, eyeball movement, especially outward, this movement especially outward. So this eyeball outward movement controlled by a cranial nerve called as a sixth cranial nerve, that is a abducens nerve. So in the given options, the sixth cranial nerve which act as a movementing of the eyeball, that is very specifically we need to remember those, right? There is a taste perception, right? This taste perception, we go with the facial nerve also, right? And that is a seventh, right? And this closure of epiglottis, we can see, right? Hypoglossal nerve, right? There is a movement of tongue, we can able to see this facial nerve. So there is a different type of hypoglossic also will control, right? This different type of cranial nerve which act differently in the body. So specifically here in this sixth cranial nerve, if you have to see this sixth cranial nerve which act for the movement of a eyeball control, especially outward eyeball control movement. Then go with the next question. Here the question is in large format, I think so. The flexures that supplies the nerve, right? So to the skin and muscle of the limbs and some of the chest muscle here. Okay, there is a different type of flexures we can see, right? This different type of flexures means, you know that, right? Nerve junction which we called as a flexures in peripheral nervous system, right? This flexures especially asking that in this flexures which type of flexures, right? Helping for, right? Skin and muscle of upper limb, at the same time chest and muscle. These areas are controlled by which type of peripheral flexures? Here especially see these type of peripheral flexures which is called as a brachial flexures, Those brachial flexures controlled this specific area like a skin muscles, right? Skin and muscles of upper limbs, along with that chest muscles also can be controlled with this brachial flexures. That is very important to remember those. Let me go to the next question, right? Last question of today explanation. This is very interesting question, those, right? So today the last question is very interesting, I think so. The sperms are produced by the process of those, you know this, right? Sperm production. So sperm can be matured in 14 days, but one sperm can travel in vast different for 90 days, means 3 months. One sperm can travel from the production site to ejaculatory site for 3 months, those, right? After 3 months of semen journey or sperm journey, it reach to ejaculation. This is very interesting, right? Interesting point of right, competitive exams and interesting point of a science. So after 90 days, the sperm is reached to the ejaculatory area. But here very important point to remember that the sperms are producing by the process what we termed as the sperm production, we call as a spermatogenesis. sperm production, which is called as a spermatogenesis. Those we know well. In 1 ml of, right, in 1 ml of sperm, minimum we can see that 20 millions to 2000 millions sperms released in 1 ml. One ejaculation, approximately there is a 2 ml in one ejaculation. In one ejaculation of so semen, we can see 2 ml, right? In this 2 ml, approximately we can see, right, 40 millions to, right, so 400 million sperm cells, right, come out. That is very interesting. 40 millions to 400 million sperm cells are come out in one ejaculation. So in this process of sperm production, which is called as a spermatogenesis. Spermatogenesis is a medical term which, right, using for the sperm production process. So this is what exactly the right answer. Ovulation, releasing of a ovum, from the ovary bag. It 14th day of menses, there is a releasing of ovum from the ovary bag. The process called as a ovulation. Production of a ovum, that is called as a oogenesis. So there is a gestational is a age of pregnancy. Gestation is a age. So age of pregnancy medically we termed as a gestation. Gestation is a medical term specially using for the age of a pregnancy in medical language. So this is what exactly the interesting option of this question, right? So this is about the 10 most common daily challenging MCQs with the next 10 MCQs, right? So we can discuss in next session. Thank you for watching this video. Please like, share and subscribe.